All right, today I'm here at the doctor and we're going over the test results of my biopsy. Now, there was a few things that it came back on this biopsy, like we thought it was an acute kidney injury. It was not acute kidney injury. It was actually advanced diabetes and blood pressure damage with vascular damage. So we're gonna figure out kind of what the plan is now for transplant, dialysis, what the next 12 months, 24 months of planning, meeting with dietitians, and all these things look like. So let's head on to the doctor, figure out what these results are, and then I'll come in here and tell you exactly what that plan looks like so you can help prepare if you're going through it. So I've met with the doctors now after getting the biopsy back. And as my biopsy told me, a lot of my damage was irreversible. It was a combination of some damage from diabetes, some damage from blood pressure, some damage from genetics. Really just a kind of a perfect storm. So now they have referred me for transplant evaluation. It takes a few months to get an appointment. So hopefully we'll have an appointment with Piedmont soon. As we go through that process, things like being able to walk 6 minutes without losing my breath in order to be able to qualify for transplant. You know, as you go through that process, they think I'll be on dialysis in about 12 months. If I'm lucky, 18 months. So the goal here is getting a transplant before I get to dialysis, which is at 12 to 18 months. So of course, the next 12 to 18 months is going to be a very entertaining time there. So this is exactly kind of what my next steps are after this biopsy. Getting blood work done about every month to 2 months to see where my EFRG is at. Now, my EFRG had gone all the way down to 28. It came back to a 30. Hopefully it'll stabilize, but it'll slowly progress and get worse and worse until it gets to that 20. As I go through the transplant evaluation, I will stay on what's called the inactive list as long as I'm above a 20. When I get below a 20, that's when I go active. And this means that's, I guess, when they start really searching out for a kidney because my numbers have gotten bad enough where I need one. So this is exactly how this process has been explained to me. Look, this is a whole learning experience for me as I go through this and figuring all these things out. I know it's probably a learning process for you too if you're going through it. And that's the exact reason why I do these videos. As I go through this process, I want you to know that someone's been through it before. And as I go through it, and I have questions, I want to make sure to try to answer those questions for you here. Like, what can I do to bring these numbers back up? There's not a whole lot I can do for my situation because the majority of my damage is irreversible. However, if you're dealing with something like an acute kidney injury, you might be able to reverse yours more than I've been able to reverse mine. So I hope you have found value from this video. As I go through this process and I see how long it takes me to get referred to Piedmont for a transplant evaluation, I'll let you know exactly what that process takes a bit. Now, going through that though, I want to tell you about this. When meeting with my doctor, they tell me, look, you may see more symptoms in stage 5, stage 3, stage 4. For me, unfortunately, I've been seeing a lot more symptoms at the beginning of stage 4 that many people see in stage 5, which are shortness of breath, a lot of pain in my back, like someone just knocked the breath out of me. It's something I've been having probably months, almost to a couple of years now. So as you go through this process, ask your doctor about this. Now, there's not a whole lot you can do for pain management other than things like Tylenol. But as you're going through this, these are the types of pains you can probably expect to have. So continue to stay tuned in. Do me a favor, hit share, subscribe, and like the channel below so you can get all the updates as I go through this process. I continue to update you as I go through this process. Thank you.